Hi everyone, welcome to Medicine Out YouTube channel. In this video, we are going to see about anaphylactic shock. Anaphylactic shock, it is a type 1 hypersensitivity. It is a result of type 1 hypersensitivity. There are 4 types of hypersensitivity reaction: type 1, type 2, type 3 and type 4. The type 1 results in anaphylactic shock. The anaphylactic shock can occur when a previously sensitized individual. It is an anaphylactic shock when it occurs because a previously sensitized individual is exposed to a specific antigen. When he is exposed to a specific antigen, the IV drug, especially penicillin, cephalosporin and iodinated contrast media are common offenders. These, which are especially penicillin, cephalosporin and iodinated contrast media, are common offenders. The anaphylactic shock when a previously sensitized individual exposed to a specific antigen, the IV drug, especially penicillin, cephalosporin and iodinated contrast media, are common offenders. The pathophysiology are injection like penicillin and anesthetic, sting, venom and shellfish. These are the things which causes anaphylactic shock. These things, which are injection of penicillin, anesthetics, sting, venom and shellfish, this have an antigen which combine with the IgE. The antigen which is produced by this agents, which is penicillin, anesthetic, sting, venom and shellfish, these antigen combines with the IgE, which is immunoglobulin E of the mast cell and basophil, and releases histamine. So after combining with this immunoglobulin E of mast cell and basophil, they release histamine and SRSA, which is slow releasing substance of anaphylaxis. Slow releasing substance of anaphylaxis is released and they causes bronchospasm, laryngeal edema, respiratory distress, hypotension, shock. After the release of histamine and the SRSA, which is slow releasing substance which causes of anaphylaxis, the slow releasing substance of anaphylaxis causes these two substances, histamine and this SRSA, causes bronchospasm. There is constriction of the bronchus is seen, laryngeal edema. In the larynx there is edema is seen, respiratory distress. They are unable to breathe, hypotension and shock. A decrease in BP as well as shock is seen. In 10% of the cases, mortality is seen. The clinical features of this anaphylactic shock are: it is due to the cerebral perfusion, there is change in mental status. When there is cerebral perfusion, there is change in mental status. Due to the reduced preload and cardiac contractility, there is hypotension. Due to the preload is reduced, the hypotension is caused. Due to the hypoxia and cyanosis is caused. Due to hypoxia, cyanosis is caused. Due to anaerobic metabolism and hepatic dysfunction, the lactic acid acidosis is caused. Due to the anaerobic metabolism and hepatic dysfunction. Due to coronary ischemia, other dysarrhythmia are caused. Due to the coronary ischemia, the other dysarrhythmia are caused. These are the clinical features of the anaphylactic shock. The treatment are: we should call the ambulance. After, always check the respiratory distress is due to the any other cause. Which cause of due to that the respiratory gets distress? They can unable to breathe. So we should see the cause why they are unable to breathe and we should cure that cause. And check the pulse and BP. We should check the pulse, which is pulse as well as the blood pressure. Stop administration of drug. We should not administer any drug in this point of time. We should keep the patient supine in position and we should administer O2 face mask, oxygen face mask. After it, we should give antihistamine, which is chlorpheniramine malate, which is 10 mg is given because histamines are morely produced due to that substance like penicillin, shellfish, sting, venom and anesthetics. These histamine as well as SRS are produced, so that we should give antihistamine here. And administered hydrocortisone. Hydrocortisone 20 mg is administered and we should monitor ABC This airway, breathing, circulation, pulse and blood pressure. Raise the legs when the BP is low. We should raise the legs. We should raise the patient's leg when the BP is low. Adrenal 1:1000, 0.5 ml. IM, intramuscular, is given immediately. 1:1000 of adrenaline is given. In intramuscular, given immediately. When the BP is low, we should raise the legs. Repeated adrenaline every 5 minutes and given. Administer 100% of O2. O2 100% is given. CPR technique, when there is when the cardiac arrest, we should compress the chest. We should keep both hands in the chest and we should press it. That is known as CPR technique. If the BP falls, then also the BP falls, we should give 1:10,000 adrenaline by IV slowly, infused in the IV and slowly. These are the treatment for this anaphylactic shock. That's all about the anaphylactic shock. In this video, we will see about the introduction, pathophysiology, clinical feature, as well as the management of anaphylactic shock. If you want more videos, please do like, share and subscribe my YouTube channel. If you want the notes of this, please do follow my Instagram page. I will put the notes in there. I will provide the link of my Insta page in my description box. Thank you.